Hi, good morning Roni. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 29th of April 2022. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Roni McMillan.
And what is your candidate number?
My candidate number is 272033971.
Thank you. Are you taking this test as a nurse?
Yes, correct.
All right. Can I see your ID, please?
Sure. Here it is.
All right. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What are the current trends in nursing?
Some of the current trends in nursing include telehealth and technology in healthcare, the use of telecommunication and information technology to provide healthcare services. In the field of education, graduate education and advanced practice is on the rise. There is a push toward encouraging nurses to pursue higher education and advanced credentials, such as master's degrees and advanced practice registered nurse roles. There is also a shift from hospital-based care to community-based care, as more patients prefer to receive care at home or in outpatient settings. Alongside, nurses are coming up with innovation and entrepreneurship. That is, nurses are opening their own healthcare businesses, developing new products or services, or working for non-traditional employers.
The importance of communication in nursing.
Communication in nursing is the exchange of information, thoughts, or feelings between nurses and patients, as well as among nurses and other healthcare professionals. Communication is important in nursing because it facilitates the delivery of quality care and builds trust and rapport. Communication also helps nurses to ensure patient safety by verifying information, reporting changes, and following protocols.
How to communicate with patients effectively.
To communicate with a patient effectively, you should greet the patient with a smile and their name. This helps to create a positive and respectful first impression and shows that you care about the patient as a person. Take your time, even if you're in a rush. This helps to convey that you are interested and attentive to the patient and that you value their time and input. Try to avoid distractions, interruptions, or multitasking while communicating with the patient. Importantly, explain things as simple as you can. This helps to ensure that the patient understands what you are saying and avoids confusion or misunderstanding. Use plain language, avoid medical jargon or acronyms, and give examples or analogies when possible. Finally, ask your patients if they understand everything to check for comprehension and clarify any doubts or questions.
The dignity of being a nurse.
Being a nurse is a noble and rewarding profession that involves caring for people's health and well-being. Some of the dignities of being a nurse are respecting human dignity. Nurses respect the inherent dignity, worth, and uniqueness of every person they encounter, regardless of their health condition, culture, religion, or background. Nurses treat their patients with kindness, compassion, and empathy, and uphold their rights to privacy, autonomy, and quality care. Having a sense of purpose. Nurses have a meaningful and fulfilling career that makes a positive difference in people's lives. These are some of the dignities of being a nurse that make it a rewarding profession.
What are the skills I need to be a nurse?
To be a nurse, you need a combination of both hard skills and soft skills. Hard skills are those that are learned through training, education, or certification. Soft skills are habits or traits that enable you to work well with others. Hard skills can be acquired through formal education, such as a diploma, associate degree, or bachelor's degree in nursing, and through certification or licensure exams. Whereas, soft skills include interpersonal and communication skills that are vital for building rapport and trust with patients and colleagues, and can be developed through experience, feedback, reflection, and self-improvement. However, depending on the specialty, setting, and role, one may need additional or specific skills to excel in the nursing career.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you.
Okay.
Your preparation time is over. You can now start your role play. Don't worry if I stop you when the time is up.
Hello, good afternoon. My name is Roni McMillan, one of the nurses working here in the clinic. May I know your name for the records, please?
Good afternoon, Roni. My name is Mihiraa.
Mihiraa, how may I help you today?
Nurse, I am diagnosed with athlete's foot. I need more information about my condition.
Oh, I am sorry to hear that. First of all, let me assure you that the athlete's foot is a common condition that is treatable. So, don't worry about it.
Okay.
Now, we will discuss the athlete's foot in detail, what the condition is, possible causes for the condition, symptoms you can expect, treatment options available, and care for prevention of further occurrence in the future.
All right, nurse. That would be of great help.
Mihiraa, to begin with, the athlete's foot is caused by the contagious fungal infection on feet, and it is mostly seen in athletes, thus the name. These fungi thrive in warm, moist environments, such as pools, showers, locker rooms, and other sports facilities, where people walk with bare feet. The condition can be easily prevented by good hygiene and foot care, about which we will talk in detail. By the way, for my better understanding, please tell me some relevant details of your condition.
Well, nurse, I am not sure how I got this condition. What I experience is itching, and there are blisters between my toes and soles, which are stinging and burning.
All right. These are some of the symptoms of the athlete's foot. It can also cause cracking, peeling, and dryness of the skin, and can even affect the toenails and make them thick, crumbly, and discolored. Since it is a fungal infection, it is hard to find out the origin of your infection.
What can be done to get rid of it?
Don't feel hopeless, Mihiraa. The athlete's foot is easily manageable. Yes, I will explain the treatment measures for an athlete's foot. Applying antifungal creams, powders, or sprays to the affected areas for several weeks can heal the condition. Alongside, you need to take oral antifungal medications for a few days.
Okay, I will do it.
That's great. Taking medication and cream is not enough. You need to follow some of the other ways to cure your condition, which include keeping your feet clean and dry, and wearing breathable shoes and socks.
Well, nurse, I am a swimmer, and I swim regularly in the pools. Can I continue swimming?
When that being said, kindly refrain from swimming for several days, until the condition is cleared. And as I said earlier, in your case, it might be from the pool area, you might have contracted with the condition.
Oh, I see. And nurse, is there any chance of recurrence of the condition?
I appreciate your consciousness. Unfortunately, the answer is yes. There is a chance of recurrence. Some of the possibilities of recurrence include incomplete treatment due to reinfection, or might be affected by some underlying health condition.
All right. Nurse, please tell me some of the ways to prevent the recurrence of the condition. Well, don't tell me to quit swimming, by the way.
No, Mihiraa, quitting swimming is not actually what is required. Moving on, let's discuss the ways to prevent the recurrence of the condition.
All right.
The prevention of athlete's foot may include the following. Wash the feet daily, and dry them thoroughly, especially between the toes. Make it a habit. While wearing shoes, use well-fit ones that allow air circulation. You should change the socks frequently, and use antifungal powder, if needed. When you are in public places, where fungi may be present, wear sandals or flip-flops, and avoid walking barefoot in damp or humid areas. Please be cautious not to share others' towels, shoes, sandals, or socks.
Sure, nurse, I will follow your suggestions.
Thank you for accepting my suggestions. Mihiraa, don't panic. Athlete's foot is a common and treatable condition that can be prevented by good hygiene and foot care.
Yes, nurse, I understand that.
Mihiraa, do I need to address any more concerns of you?
No, nurse. I am all good with the information you have provided.
All right. Mihiraa, always feel free to contact us for further queries. I wish you a speedy recovery.
Of course. Thank you. That is the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.